Okay, shouldn't have had so much coffee before this, but give it a go. Okay, my name's Alannah, and I'll be discussing my practicum at the Canadian Red Cross in Burnaby. The Canadian Red Cross is the leading humanitarian organization through which people voluntarily demonstrate their caring for others in need. Their aim is to mobilize the power of humanity to improve the lives of vulnerable populations and reduce health inequities. Since the outcome of a disaster such as a large-scale fire, flood, or ice storm can be catastrophic, the Disaster Management and Preparedness Department immediately responds, recovers, and rebuilds communities. With the ability to mobilize over 5,000 trained volunteers, the Canadian Red Cross offers immediate services such as family reunification, emergency food, clothing and shelter, and comfort and psychosocial support. Sorry. I had the opportunity to work as an ambassador for Walmart's annual campaign to assist in one of their largest funding initiatives and gain insight into the processes that are the foundation of their work. Since 2003, Walmart has raised and donated over $41 million to the Canadian Red Cross, and this year they reached over $2.6 million. My job as an ambassador was to execute the campaign at the Tsawwassen Walmart by carrying out various tasks such as speaking on behalf of the organization to relay information, building partnerships, engaging in community development, ensuring necessary tools are available, attending events to create a strong presence, and providing motivation. In addition to these tasks, I had a special focus on identifying ways to improve training outcomes. By applying interprofessional skills and knowledge in relation to topics in health and community services, I was able to develop a list of key insights and resources for the Canadian Red Cross to help facilitate the integration of these concepts into the training procedures for future ambassadors. I will go into further detail about some of the most important ones. Communication strategies. In regards to productive communication, I use strategies such as actively engaging with the audience in my speech to create an environment for two-way feedback, clearly identified my position and theirs for the campaign to clarify roles, and I spoke clearly and slowly to effectively relay information. In regards to the facilitation of health literacy, which is defined as the degree to which people are able to access, understand, evaluate, and communicate information, which is critical in order to promote and maintain good health across the life course, I was able to apply strategies such as knowledge translation. I clearly stated in my speech at Walmart that the information is easily accessible, where it is available, and that it is offered in various languages. In addition, while sharing information from the Canadian Red Cross, I reflected on whether the promotional material was at a reasonable literacy level and communicated this using the plain language guide. In regards to critical thinking, I applied knowledge from the course materials to help guide me as there were times where I was required to make decisions on my own. Since I have learned that our experiences, beliefs, and values can influence our ability to make informed decisions, I use strategies such as note-taking to track my feelings and reflections, and kept in contact with my coordinator to disclose important information and receive feedback. In regards to engaging stakeholders for collaborative action, I used tips from the community toolbox to increase participation. I was aware that although Walmart and the Canadian Red Cross share the same goal, the reasons for this may differ. Some strategies I used were clearly expressing how valued each stakeholder was, offered opportunities for further involvement to increase incentive, and made myself available to answer questions and create an engaging environment. Since my practicum position offered me an opportunity to work with various people of different backgrounds, cultures, and ages, I relied on public health and social policy values to guide my experience. The three most important values were critical analysis, drawing on principles of social justice. That was kind of the last slide anyways, but. Oh, now it's better. I can skip through it. This is great. Not keep going a little more. That way. Okay. No worries. I relied on public health and social policy values to guide my experience. The three most important values were critical analysis, drawing of principles of social justice and equity, cultural safety, and building partnerships with the people and populations served. My overall experience at the Canadian Red Cross was very beneficial. Since I was lacking experience prior to my placement, it was incredible to be granted the opportunity by my supervisors, Sandra and Christine. I was able to put to use the skills and knowledge that I acquired throughout my BA program and integrate important concepts into my work. As we come to the end of our program, I want to thank my teachers for the opportunities they provided me. This program allowed me to continue my studies on a farm in Colombia, a fishing lodge in northern BC, and on a road trip to Guatemala. All along the way, I was able to apply course knowledge to real-life situations to see just how practical this program is. And I will not forget the opportunities it offered me. Thank you.
Any questions? Well, I have a question. How long has the association been between Walmart and Canadian Red Cross, and how was it established in the first place?
It was since 2003. I know that they started doing the campaign. I'm not sure prior to that what the partnership was. And it started off, Walmart has certain organizations that they work with. They just have few of them that they do big campaigns with. So they just chose the Canadian Red Cross as one of those.
Do you know how many other organizations they work with, or? I'm not
sure exactly. I think there's maybe Walmart. I think works with a lot of them, but they do like an annual funding campaign for I think 4 or 5 of them, but I'm not sure. So don't quote me on that.
Good.
Yeah.
Thank you very much. Any other questions? Good. Well, if not, thank you.